In Fox 5 Health News, new warnings about the liquid nicotine commonly used in e-cigarettes. New Jersey health officials say there could be serious risks, especially for young children.
So joining us now is Dr. Doris Day, Clinical Associate Professor at NYU Medical Center. Dr. Day, thanks for coming in.
Thanks for having me.
So this is actually very, very potentially deadly.
This is scary. And the problem is that it's going to be on the rise. E-cigarettes are more and more popular. I actually went into an exam room the other day, and a patient was smoking an e-cigarette in the office.
Are you serious?
Like, yeah, I was like, what's wrong with you? You don't do this in a doctor's office. So yeah, so people are getting very comfortable. The problem is that these are in kind of fun colors. These are the refills for the e-cigarettes. They come in very cool colors and flavors. And to a child, it looks like candy or something fun to drink. But it can be deadly. One of the little refill packs can kill 4 small children.
Wow.
We're not just talking about hurt, we're talking about kill. And it's not just that they drink it. Even touching the skin, it can be absorbed like a nicotine patch, and it can be pretty deadly. So just looking at calls into poison control centers, there have been over 215 calls nationally just per month, just this year. So, and that's up from like 10 from 2010. So these calls have jumped, and these are only to poison control centers, not the ones that go to the emergency room or where they call 911. So this can be a really deadly problem. Children are dying from these e-cigarette refills.
It's scary to think just a couple of drops could really do some serious damage.
Yep, and to adults as well. There was someone who was just carrying it, and the e-cigarette refill broke, and it got on his skin, and he had a jittery feeling. So you can have symptoms of nausea, vomiting, feeling really jittery. Your heart can race. So these can be very problematic, and you have to be careful. It's serious.
Do you think the same rules with regulation should apply that apply to traditional cigarettes as far as where you can smoke them and how you buy them, those kinds of things?
You know, the more we can limit how much exposure people have, I think it's definitely only for adults. Unfortunately, they are available. I wish they would go away. I don't think there's any shortcuts. I don't think it's a healthy habit. I think it is harmful, and in the long run may show to be as harmful as cigarettes. But you know, it's a battle.
All right, let's switch topics now. Beards, they're in. And we're not talking about a little stubble. We're talking about big beards. But they can actually kind of be germ hotels, essentially, on your face.
This is true. The beards are in an area where there's exposure from just saliva and fluid that comes out of the mouth. Food that goes in the mouth can sometimes end up in the beard. And your skin naturally harbors bacteria. Our skin is designed to live in the world where there's lots of germs, things are trying to invade all the time, and your skin has a great defense mechanism. But the more surface area you have, and every strand of hair on the beard is more surface area for bacteria to sit, to harbor, to grow. And the beard hair is made up of protein, which is even food for some bacteria. So it can be problematic, and it can be transferable. So if you're a person with a beard, you know, you worry if like a surgeon has a big beard or someone preparing your food has a big beard, of things ending up in the food, bacteria and germs. That's not the most fun thing to think about, but it can happen. And also your partner can be exposed to those germs and that bacteria. And even if they don't have an infection, if you have the beard, you may not have an infection, it's in your skin. You may be okay handling it immunologically, but the person you come into contact with can get an infection.
So what do we tell, my husband has a beard, so what do I tell him to do? Do we tell him to shave it, or what is he, what are his options?
Shampoo?
Well,
I mean, do you use
even
shampoo?
once you wash and shampoo, the bacteria is still there and can still grow, and it can be harbored pretty quickly, like really within hours. Shaving, obviously, having a smooth skin is the best because you're getting rid of the problem. But at the same time, that's not what everyone wants to do. There's an aesthetic to it. So you can have beard hair. You just want to keep it as clean as possible, as short as possible, and know that if your partner has a reaction or a rash, then you need to take other measures and sort of figure it out together.
All right, Dr. Doris Day from NYU. Have a great weekend. Thanks for coming in.
Thanks, Dr. Day.